To the Democratic Republic of Congo, and there's been a spike in the number of Ebola cases. It comes after a militia attack led to the suspension of operations to contain the epidemic. 27 new cases were reported last week in 2 eastern provinces. That's 3 times the average number of infections. As CGTN's Chris Okaringa reports, security has now been increased outside Ebola treatment centres.
The fight against Ebola in the DRC has been set back by an attack that occurred in Ituri province late last month. 4 healthcare workers were killed in Biakato mines, prompting aid agencies to suspend operations. Congolese officials say they have stepped up the protection of patients and healthcare workers in those areas.
The problem of insecurity will be resolved with the number of soldiers we are bringing there. And also the security measures we will introduce around the Ebola treatment center.
The attack has led to a resurgence of new cases. Officials recorded 27 new cases last week, compared to an average of 7 cases in the previous 3 weeks. Most of the cases are linked to an individual who contracted the disease for the second time this year.
This case is related to the guy who was a survivor. But we don't know how this guy was infected. Maybe it's a resurgence of his first infection. Yes. So when he was healthy, he started to work with the Ebola patients, because at that time we thought that he was immunized. But after 2 or 3 months, he was infected.
Experts are investigating the circumstances around the Ebola survivor's case. The new infections have reversed a decline in the number of cases recorded over the past 3 months. Congolese and international health experts had hopes of containing the Ebola outbreak by the end of this year, but the attack on a treatment center in Ituri province has led to an increase in new cases. President Tshisekedi has said he will do everything possible to end the attacks. The people of North Kivu and Ituri provinces are only waiting for that promise to be made a reality.